Good afternoon, New Mexico, and thank you very much for joining us for our weekly COVID briefing. I apologize that I didn't participate in a briefing last week, but really wanted to get a sense about where the trends are, what's happening, and make sure that as we're making the next set of critical decisions, that we do that with as much data in front of us as possible. So it's nice to be back, although I always wish for nothing but positive information. I'm afraid today we've got case updates that give me pause. But as we get there, I want to thank President Rick Bailey from Northern New Mexico Community College for providing me with an Eagles, their mascot mask, and it fits perfectly. I also want to, do another kind of mask demonstration and highlight the talents of a young New Mexican, August Hanel, 23, lives in California. August, please come back. He's with Livermore Labs, and he has been busy 3D printing, although he didn't, as he wanted me to know, design the actual program to make these. This little device, and I'm going to have Secretary Bill McCamley, so you have to move the camera over there for a second. There you go. These take the pressure, there we go, Bill, show everyone, off your ears. So they're really handy and amazing. I wanted you to be able to see that. My hair got in the way. Thank you, Secretary. And the reason I'm showing this to you, and then back to me, there you are, thank you, is because wearing masks takes a lot of getting used to. And I know they're hard. They're hard for us even in these press conferences, but we do it because we care about each other, we respect each other, and we know that they work. And anything that can make mask wearing easier and better and more comfortable is welcomed support and advice. So, August, thank you very much for sending me these. Thank you for working hard in California. Thank you for demonstrating the best of us. And for all the other New Mexicans that are wearing masks and doing your part, we are truly grateful. Okay, let's go to the case update. All right, so we have 18,163 total positive cases. Unfortunately, we have 343 new cases today. That is our all-time high since we've been battling this pandemic. And that in and of itself is not good news. Hospitalizations were fairly stable. You'll hear more about that. We have 167 people on the hospital and 34 on ventilators. That's actually really good. But I want folks to be careful about that data point, and that is, remember that as we have increasing cases, we have a 2-week or so delay in what we see in hospitals, and worse, what we see in mortality issues. Now, you're going to get some other data points about the populations who are currently impacted by COVID that we think might shift this. So that's not terrible news, but it's something we must be diligent about and keep our eyes on. We cannot overwhelm our healthcare system. We have 596 total individuals who have lost their lives. Today we have 5 new deaths. Unfortunately, one of those is a 40-year-old, underlying conditions. Every single one of these is mourned by everyone in the state of New Mexico. And what's really horrifying around the country is I don't know that there are any Americans left who don't know someone who has either gotten very sick and have been hospitalized or who have lost a friend or a loved one to COVID. And those are data points that none of us want to recognize, acknowledge, or talk about, but it doesn't make them any less true. We have conducted 496,985 total tests. We continue, and I hope someone, that was actually a primer, asks me about testing. I want to make sure that we get the record straight. We continue to have anywhere between 50 and 71 testing sites available statewide, and we'll continue to be diligent to get as many New Mexicans tested as we can, while making sure that our priorities about testing, so that at-risk populations, people who are sick, folks that We are doing surveillance, trying to stay ahead, that we do everything in our power to do that, and that we don't minimize, that we want testing available in as many counties and as many communities as we can every single day. So you have our commitment to continue to do that, and I feel fairly confident that we'll be able to manage a variety of testing systems that will meet New Mexico's needs for the long haul. And with that, let's go to Dr. Scrace for modeling. Dr. Scrace, thank you.
Thank you very much, Governor. And if I could have the first slide, that'd be great. Sorry, there we go. So starting today with this slide, I was asked at a Legislative Finance Committee meeting on Friday, someone, I think it was Senator Munoz, said, could you just give us one number that we should look at? Does it have to be this complicated? What's the one number? And I know Dr. Smeltzer from epidemiology, myself, both answered the same. It's the thing that we look at the most that we think has the biggest impact on the state is the 7-day rolling average of positive cases. And that's the graph you see here. You've seen it many times before. Just a brief update for those of you who are here for the first time. The dotted blue line at the top is all of New Mexico, and these squiggly lines down below are the various regions of the state. One thing that you can see that really sticks out in the regions is that green line, the top line below the blue line, is the central region of the state, where we're seeing a really significant uptick in cases that is driving the increase. The 7-day rolling average ratio is more than doubled, 123% increase in the past 5 weeks. And I just looked it up with a new case count of 343. It was 115 6 weeks ago. That's basically a tripling of the number of daily cases in the state, putting us in the zone that is the worst we've had so far. That curve did flatten again. Thank you, New Mexico. Cases dropped yesterday. They went up today. That will affect that curve. It'll notch upwards when we recalculate. But this is the curve that we mainly follow, and this is the one that tells us that we're still having a significant problem. You'll see later how that affects other metrics, but I'm going to come back to the spread rate and notice that this curve here is essentially, the top part of it is flat. And I am going to come back to that in just a couple minutes. If I could have the next slide, we have some heat maps. The one on the left is the one you've seen before. Debaca County now is the only county without any cases in the state. Mora has had 6. You see that hot spot that we always look at in the northwest part of the state? That remains there. But 3 other things that are worth noting is notice that the southeastern corner of the state in the lower right there, it's starting to get darker orange. And we're seeing an awful lot of activity in the southern part of the state, also in the southwest a little bit as well. And the other 2 things, if you go to the map on the right, this is just the number of cases we've seen here in New Mexico in the past week. Bernalillo County, 649 cases in 1 week. Doña Ana, 275. And now Lee County, which has a relatively smaller population, with a significant increase of 132. So just in the past week or so, we're seeing a much broader spread across the whole state. And the main thing driving it, which is what we always get asked, but the main thing driving the growth and this uptick in cases in New Mexico is more people are spending more time outside their homes with more other people for longer periods of time interacting. And that is how COVID spreads, with human-to-human interaction. The next slide brings up something else that's a very alarming trend, at least to me. We've been talking week after week about the percent of cases in kids, and it's been pretty consistently, 12.5%, 13%. We've ranked in the top 10 in the country. And on the science and data update we did on Friday, showed some very detailed graphs of trends and what's happening in the population. When we started the pandemic, you will all remember that a lot of older people had the disease, and they predominantly were the cases we're seeing. Now, if you look over time, children over the entire course of the pandemic, and by children I mean 0 to 19 years of age, are 14.9% of cases. But in the last week, we are now up to almost 22% of children. And the big growth actually in this past week, the number 2 group in the state on several days is this 10 to 19 group. There's a couple things we know about the 10 to 19-year-olds that we didn't before. We've been saying we're hoping we'll get research from other countries, and South Korea recently published some research there that's been very helpful to us. One thing that we do know is now, at least in one study, and it's only one study, is that the 10 to 19-year-olds tend to transmit COVID very similarly to other adults. And so the myth that kids can't transmit it is turning out not to be actually true. Now, it's true the children still have different symptoms, more gastrointestinal than respiratory. Maybe initially it's also true that they may be less severely ill. But when it comes to transmission, this 10 to 19 age group is much higher. And the younger kids, less, it appears, you can see less cases, maybe less transmission. But households, when South Korea reopened schools, there were more actually people affected. I think it was 14% of household contacts of kids in school acquired COVID, whereas people who didn't have school-age kids at home was only 1%. So we're watching this closely, watching the issues with the kids. Fortunately, the vast majority of these children are not being hospitalized, but something to bear a close watch. People debated about whether I should put this picture in today. The next slide, it's just a little bit more about masks. There's a great website, a video that PBS has put out. We'll get that link to you that actually shows you what happens with breath with and without a mask. It's just fascinating. There's no question, though, that they work and they do reduce the transmission of COVID. And one of my deputy secretary's friends was so inspired by the demonstration we did about how to properly wear a mask that they now have their dog showing you the correct way, upper left-hand corner. But again, I like to go over this every time. Mask needs to cover your nose, your mouth. It should be tightly fitting. Please cover your nose and mouth. Don't just put it on your chin or the other demonstrations that the dog is doing for you here. But there's just overwhelming evidence now, and I'm still getting requests from people like, what's the evidence that masks really reduce spread? It's quite overwhelming. There's universal scientific agreement. If you're interested, Google it. Also, Sunday morning, 4 people sent me a video, we're on the next slide now, of a physician going through who is debunking the myths. And what I've done here is I've labeled what she said as myths, because most of what came out in that conference wasn't true. And then we've given you a little reality perspective. I'm not going to go through all of them in detail. I have included footnotes here with references for what the reality is. Only a tiny fraction of people infected with COVID-19 have died from COVID-19. It's true that the mortality rate is running, it depends on the state, but in the 4 to 8% range. But more people have died in the United States from COVID-19 than U.S. soldiers died in battle during World War I, the Korean War, and the Vietnam War combined. It's taking its toll. People think mutations make the virus more benign. Los Alamos National Lab tracked all of the mutations of the virus, and there were dozens of them in April, and we have not found any clinical difference in any of the various viral mutations. Hospitalization rates seem the same. Viruses that were predicted to be more benign, still putting the same number of people in the hospital. The fact that the idea that social distancing isn't really a public health tool, that really is a myth. And the idea that there's no justification for normal, healthy people to wear masks, it's also false. I've given you some references. We have a bundle of references if you're interested on that. I'm going to get to our gating criteria now, because we're in an interesting situation with the highest number of cases we've ever had, ever in New Mexico in a single day today, and 4 of our 6 gating criteria looking like they're meeting our targets. You can see contact tracing. We have 3 times as many cases, as I mentioned, as we'd had 5 weeks ago. Also, our contact tracers have been substantially more effective than other states. We are contacting 83% of people who test positive. Other states, Louisiana is the second highest that I've seen at 59%, but most states you read about are in the 40%. So we're just about double most states. So 3 times the cases, contacting twice as many people, 6 times the volume. and they are working to hire additional people and move that along, but we are behind there. I got actually a number of questions and a newspaper article this week about, well, why is the spread rate like 1 when in good? Why is the spread rate good when our cases are the highest they've ever been? So very briefly, when the case curve is going upwards, the spread rate is always greater than 1. When it's flat, it's 1. And when it's going down, a little or a lot on either side, when it's going down, then it's less than 1. Well, the problem with the spread rate and using only the spread rate is the spread rate can be 1 if you've had 10 cases in a row per day for 10 days or 10,000. So it tells you about transmission and whether it's growing or not, but it doesn't necessarily fully quantify the problem. Hospitals still doing well. They're recalibrating their hospital beds and ICU beds, and we'll have different newer numbers for you next week, similar to these, though PPE doing well. And testing, again, off the charts. Kudos to the governor and Secretary Kunkel for making that work. It also would appear that most reporters have taken an accounting class, and if we can go to the next slide, I'm getting a ton of questions also about what about if someone from New Mexico gets hospitalized in Arizona, or what if someone out of, from Texas gets hospitalized here? I've just narrowed this down to Arizona and New Mexico for the purposes of this, but what's true in Arizona is true in every other state. And basically, if you're in your own state and you're tested and you're positive and you're hospitalized, all 3 of those are tracked in your own state. And if you're a New Mexican and that happens, all 3 are tracked here. If you are a New Mexican in Arizona, and that's the blue figure we have there, you will be counted in the Arizona list of tests, the Arizona hospitalizations, but your case will be referred to New Mexico within a day and tracked here in New Mexico, and vice versa. So New Mexicans who run out of state who get a test out of state, their hospitalization will be tracked out of state, but their case is kept track of here in New Mexico. And just again to reiterate, you can have 20 positive tests, you're still only 1 case. We haven't gotten to that period, but we're coming to it where you might get COVID again for a second time. We're not sure about that, but for now, it's only 1 case we keep track of cases, not tests. So just wanted to make that clear. We talked last time about 10% of our cases, 9 to 10% are from out-of-state travelers coming in, but then another 9 to 10% are from New Mexicans leaving the state and coming back. And hospitalization, same thing. We looked at a short period of time last week, and in general, during that period of time, there are 19 people from other states in New Mexico hospitals, and there are 18 people from New Mexico in out-of-state hospitals. So that's a wash, and I don't think there's much going on there to say more about. We're going to talk about schooling today, and if I could have the next slide, what we're going to do about schooling. And I want to give credit to the NCAA, who had a slide very similar to this that was sent to me, and we adapted it for New Mexico. But they're, of course, struggling with their sports decisions, and they are making the point, as we are here, that back in early June when we started the modeling for schools, things were looking fairly good. And we projected this dotted line out about where we thought we would be around August. And you can see we thought we were going to be in good shape. And then if you look at where we are today, it's a completely different picture than what we projected. Modeling is good. It's particularly good 2 to 4 weeks out. As you can see here, it can't predict the future completely. And so we've remodeled all the different scenarios to figure out what is safest for people. I also wanted to say, too, that one of the things we learned about the spread rate when we saw it was 1 and we had a record number of cases is we're realizing that, like the other gating criteria, it might not be bad to have at least another way of looking at these things. And so we are using evidence. We're watching what's happening nationally. And I wanted to show you 2 other measures that we are tracking that we're going to start to use for focused testing throughout the state in areas where we think we're having more of a problem. Those 2 measures to complement the ones we have in the gating criteria. The first one is the average daily rate of new cases per 100,000 New Mexicans. Now that's a little tricky because it seems like a lot of complicated math, but in New Mexico, we have 2.1 million people. And could we go to the next slide with the map? Sorry about that. Oh, we are on it. Thank you. I apologize. You just multiply by 21. So if we had 100 cases, if we had 10 cases per 100,000, that would be 210 cases in New Mexico. And so we're tracking that, and we're not sure on what number we're going to peg it at, but anything over 10 is an area of concern for us, and where we're focusing to go out and do more testing. And you'll have to probably pull this up at home, but there's at least a dozen counties that have more than that number 10 right now. And again, hotspots in the corners of the state as well. And on the right-hand side, the last measure I wanted to talk about today is test positivity rate. We've been reporting that, we've been showing graphs, but it really is becoming a national benchmark for adequacy of testing. So right now, the testing team is looking at this in detail and thinking that if we see more than 10 cases per 100,000 per day, and we see a test positivity rate that drifts above 5%, that's an area we need to go in with more testing resources and more public health resources to try to provide containment. These rapid responses are happening, and I'm going to introduce Secretary Kenny in just a minute to tell you more about that. But again, as I'm closing, remember indoor spaces, particularly where there's poor ventilation, and ventilation is becoming a big concern now with COVID, a lot of attention there. Crowded places, you remember a crowd in New Mexico is 5 people, and so that's what the public health order still says, understanding that it's one of the most restrictive in the country, but also understanding that that has helped us in many places and at different times to contain the virus. And then that close contact. And when these overlap, your risk is twice as high, or in the middle, more than 3 times as high, because you're involved in all 3 of those activities. So really, the virus has not changed. It's just us that are making those curves. Reopening really cannot go forward without really all of us taking the actions that, like wearing masks, socially distancing, staying home unless necessary. We all have to do that to make this work. I want my child at home to go back to work, to go back to school. I really do. But in order for that to happen, we can't be at our highest ever number of cases, and we can't afford the results that our neighbors are having. So again, stay at home, wash your hands, wear that face covering, maintain 6 feet of social distancing. And then with that, I want to introduce Secretary Jim Kinney. He's the Secretary of our Environment Department, and he's going to tell you about what he does and how it relates to the effort that many more cabinet secretaries have become involved in testing with different groups of populations. And Jim's going to tell you today about his work with employer groups, which has been really phenomenal.
So thank you, Dr. Scrace. Thank you, Governor, for having the Environment Department here today. As Dr. Scrace indicated, my name is Jim Kenny. I'm the Cabinet Secretary for the New Mexico Environment Department. Many New Mexicans probably know the Environment Department as the state agency that oversees the regulation of air quality, safe drinking water, and cleaning up hazardous waste throughout the state. What you may not know us for is our other programs that we administer on behalf of New Mexicans. Those programs include 2 important ones related to COVID. First, we implement the state's occupational safety and health program, which I'll just refer to as the OSHA program. And secondly, we also issue permits for restaurants and food manufacturing facilities throughout the state of New Mexico, with the exception of the city of Albuquerque and Bernalillo County, which both have their own programs to issue food permits and food manufacturing permits. So our efforts with respect to our OSHA program are always to keep employees safe, and safe from things like physical chemical hazards as well as biological hazards like COVID. And I'm here to, as Dr. Scrace indicated, to talk to you a little bit about the efforts that we're taking to not only keep New Mexicans safe, but to keep New Mexico employees safe as well. With respect to the concept of rapid responses, what typically happens, and let me first define what a rapid response is. A rapid response is when an employee tests positive for COVID. And when that occurs, the Department of Health, as well as the New Mexico Environment Department, we sit down every day and we go through that list of New Mexicans that test positive, the positive data. And at that point, we work together to figure out which agency is going to conduct a rapid response. And just for some numbers, we are over, I think, 800 rapid responses, and about 82% of those rapid responses are handled by the New Mexico Environment Department's OSHA program. So odds are, if you are an employer and you have a positive employee, you will hear from the New Mexico Environment Department's OSHA program. That typically happens within about 1 business day, and we will contact you by phone. When that happens, we will explain the rapid response process to you. You may also get contacted, I should say, for the balance of the 82%. So the remainder of those rapid responses are conducted by like the Department of Health itself, or maybe the Department of Corrections, or another state agency. But predominantly, it's the New Mexico Environment Department. But regardless of who contacts you, and regardless of where your employee is who tested positive, there's 5 common elements that are going to happen. And those 5 common elements are always as directed by the department that you're working with. And those 5 elements are as follows. 1, it's a temporary ceasing of operations. And when we talk about that, we tailor that to the business in which we're working in. So if a positive employee is a security guard, then that may not mean a full closure of your business, just as if the positive employee is in a manufacturing part of your business, your shipping and accounting may remain open. It's all dependent upon your practices and how you're implementing those COVID-safe practices in your operations. So the first criteria is the ceasing of operations. The second one is testing and directing self-quarantine of those individuals who tested positive. The third criteria is the retesting of employees, usually about 7 to 10 days later, to ensure that they test negative prior to coming back to work. The fourth and fifth criteria are ones in which the owner or operator of their business would ensure that they disinfect the workplace, again, in full or in part. It just depends on the operation, and we work with people to figure that out. And the fifth criteria is to implement a safety plan. And most employers have implemented a safety plan, but it's also really important that you document that you're following your safety plan, not just that you have one on a shelf, but it's meaningfully put into place in your business. When it comes to rapid responses, I gave you a little bit of information about how New Mexico Environment Department is handling that. But I wanted to break down a little bit of the data for you, and I apologize that I don't have any slides here today, but you can find all this data on our website, and you can find the charts and graphs that help break down and analyze this data exactly right on our website as well, which is simply env.nm.gov. But the data that I wanted to share with you today is we've been conducting rapid responses for now about 8 weeks. And over the course of those 8 weeks, we've seen some interesting data, some interesting trends. For example, the food industry, which I'll break down as having 3 components: restaurants, grocery stores, and food manufacturing processes. So those 3 sectors make up the food industry as we reported out in our data. Over that 8-week period, the rise in positive employees at restaurants has increased 15-fold. So going back 8 weeks ago, we didn't see that many restaurants having positive employees. Last week was our highest week yet, and that's increased by a factor of 15. Contrasting that to grocery stores and food manufacturing facilities, which started out fairly low and have remained very low over the past 8 weeks. There was a blip in our data around the 4th of July, probably many New Mexicans going out to celebrate Independence Day and getting essential groceries, but at the same time, that number came back down at grocery stores. So that same data, that data over that same period of time does not show the trend that we're seeing at restaurants. And as I said, if you as an employer are contacted by the department, we are happy to work with you. We are happy to walk you through this rapid response process. Unfortunately, with the number of rapid responses that are happening throughout the state of New Mexico, we're getting good at this. We're good at this. We can deliver the results that minimize disruption to your process, provided you want to work with us, and we can get things moving again. So if you need to reach our OSHA program, you can reach us at 505-476-8700. And thank you. And Governor, I'm going to return it to you. Thank you.
Thank you, Secretary Kenny. And most New Mexicans are going to be more like me in the context of hard to keep track of all this information. We have a limited capacity in the system that we use. I want to thank the men and women who help us put this system together so that we can have at least weekly environments where we're providing to you directly all of the data points and information that we analyze daily. And when I mean daily, it's a 7-day-a-week effort where we are looking at what's happening in every community in the state and spending a great deal of time on what's going on in the country and reviewing evidence-based information about what's going on globally, because it's a pandemic. So all of the information that Secretary Kenny gave you is available on all of our data websites. It's available on his website, and we'll also get it out to folks viewing. And this incredible tech team is going to work with us to improve and increase capacity so that, because we're going to be doing this for a while. And we know that this pandemic, no matter what the White House says, doesn't disappear in the summer, doesn't get easier to deal with without a vaccine, that the tools that we currently use, public health practices and limiting or being careful about allowable activities in our states and communities, those are the only things that are really available to us to protect people, to protect the economies to the best of our ability in a situation where you have to limit access, and to protect our first responders and frontline healthcare workers. Every state is managing in that context because that's all we have. So we'll get that to you. And I want to just provide an example that in this incredible uptick of rapid response, and that it is all hands on deck for state government who, we don't have, and we shouldn't. We should be focused on the priorities of the state. We are. But you add a pandemic to that, that means everyone's got to work with each other to do enforcement, to do education, to do all the data work that you see here all the time, to contact individuals, to make sure that they're isolating, that they're safe, that they know where to get tested. I mean, all of this is work we had to stand up because we're in a international public health emergency. But New Mexicans, I think, in large part, are really working on better public health practices. I can tell you that we don't have enough statewide mask wearing. We got to get to 80 or 90%. Otherwise, we're not going to be able to get the positivity rates and to get the case rates down to a safe, manageable place so that we can return to more normalized daily activities. That's one. Two, we got to limit how much we're going. So not every New Mexican, although many of you are. I think we've got a couple of photos. I want to show folks what these are from today. Do we have those up? Yes. All right. These are two photos. The first one on the top is Taos, and this is around the plaza. So these are people outside wearing masks. You can see that, frankly, as far as you can see in that photo, people are wearing masks. By contrast, this is indoor dining that is not allowable in Hobbs. And, I've tried to protect people, and so the folks have the masks easier. We've actually given people masks in this second photo. They are not wearing masks. Those workers are also not wearing masks, which you cannot tell, but I can tell. That means they're at risk. And I worry about three things more than the obvious about the Hobbs photo. One, I don't think that the individuals who are trying to support a local business understand the risk that they're taking and understand that they're creating enforcement issues that we take seriously. Two, that New Mexicans should know that that restaurant's already had enforcement action taken, and that community isn't working with us to hold them accountable. And when we do that, people die. We lost someone, a 40-year-old, in Lee County. We are spreading COVID. And when we see the kind of uptick that we're having, we know that it creates for then us as a state to have to make really tough decisions to make sure that we're doing everything we can productively, safely, and responsibly for COVID. So I wanted you to see that, because until we get as a state to moving less and to wearing masks more and to socially distancing more, we aren't going to be able to function as effectively as we certainly could given this pandemic. So let's talk about the set of decisions related to the data today. First slide. All right, so New Mexico is going to delay in-person learning through at least Labor Day, which is September 7th. I know that this is a really hard decision. There are parents who are going to be concerned about childcare. We're working on it. And we will be getting information out to everyone. And schools and school districts are working with us to make sure that we do that. Two, this does not mean that things are not happening in our school system. Our public education system is going to keep working to make sure that they're going to be ready for in-person schooling on September 7th. If we can meet that goal effectively and safely, they're going to have to do more work to figure out how we do that distancing and how to do those returns safely. We also want to make sure that this time is spent improving distance learning. They all have the right support and directives so that online learning starts as soon as the school would be starting. For some districts, that's as early as August 3rd. For other school districts in the state, that continues through August 17th. Every school will be supported to make sure that distance learning is occurring. So this pause on in-person reentry is not the same as delaying education support. I want to make sure I say that again. The pause is on in-person learning, all grades. It is not a pause on making sure that we work to meet our educational requirements and standards for every student in public education in the state of New Mexico. I want to also point out that prior to this decision, remember that the state has a statewide funding effort and a funding formula. We do statewide accountability. We set statewide policies and guidelines. But schools are a locally controlled environment. We think that's a good thing. 40% of the districts had already made a decision to pause in-person participation in the classroom. And for the very same reasons, we're saying to all school districts, they have to pause in-person or in-classroom education, because the data that we have about what's happening with COVID in the state of New Mexico is far too problematic to allow for in-person education. We also want to know that we want parents to know that we are directing additional CARES Act, that's the federal stimulus money, and related funding so that distance learning can be improved. That means more devices out to kids and families. That means figuring out the last mile of connectivity. I can also say with a great deal, unfortunately, of confidence, we are aware it will not fix every problem for distance learning for every student. We are going to do our very best to do professional development, improve our techniques, improve access, and do a much better job because we've got this time to really get it right so that we are not missing anything for distance learning and getting ready for in-person learning. Next slide. So here's the next steps. So our target, which I just said, is September 7th. That's the day after Labor Day. We're going to then go back to the phased-in model. So it's a hybrid model. We start by bringing in smaller groups of students. They return to campus, and we want to make sure that in order to maintain an in-person school environment, our next step and goal is to bring the K-5 students back first. So the effort today is that after Labor Day, we bring in our youngest students first. Now, why would we do that? Well, the youngest students have the most difficult time getting the most out of distance learning, all right? So that's an evidence-based situation that we know we need to deal with. Two, because of that, they have the most risks for falling so far behind, we can't get them caught up. And third, it's an incredible group to begin to work on, because they're the toughest group on some of the public health practices that we have to get right. So it allows us to focus on all of those issues all at the same time. Then what we would do is we would start to bring in, say, the next group and the next group. So mid-school students, high school students. The effort here is to start in-person, hybrid. That means it's not 5 days. That's what a hybrid model means. All right, so some distance, some in person. And we take one cohort of kids, we're successful, we build in the next cohort of kids, we're successful, we bring in the next cohort of kids. We want to get to full reentry in 2 ways. All students, all age groups, all schools, and then the ultimate goal in New Mexico is to have no hybrid models. 5 days a week, all populations, all in school. I want to just tell you one more thing about this slide. That is not going to be easy. And if you're watching and listening, and we are reading and evaluating, and I participate in calls every single week with every single governor across, and every territorial governor all across the country, about what we do about schools. And we're all creating separate gating criteria, looking at how that should be evaluated. We're getting more science-based information about the disease, about how it spreads, about who's at risk, about what's going to work. This is uncharted territory. And I do think that parents, and I get it, are really frustrated. But if you don't have the right evidence and you know that the risks are severe, you got to go slow, you got to be cautious, you got to be safe. And what we do know is that countries that successfully got their kids into an in-classroom had a rate of infection, which is in our gating criteria, below 1, all right, and also had a prevalence or positivity rate that was sustainable and low. And remember, when New Mexico was doing really well, we were at about a 3%. So out of all the tests taken in a given time frame, a day, 3% of those tests were positive. That continues to increase, and in some areas, it's well above 5. In some, it's creeping up close to 5. These are bad signs, not good. And so the successful places in the country who got hit with the virus earlier, we can see from their experience what worked, what didn't work. That's useful to us. And states are also going to learn from each other. I predict, while I'm not the first to make this decision, I'm early in making this decision because parents need time, educators need time. I predict that many more will follow with this decision, because what's going on around the country is the United States has 4% of the world's population. We have well more now than 26% of the cases, and as you can see, the mortality rates are increasing. This is a national tragedy, and it's all related to the fact that we don't have a federal national strategy. And so states are left to their own, and too many Americans are traveling too often between states, and that's creating huge issues. Next slide. All right, so We are not going to abandon, and I don't want to candy coat this. We know that there are challenges and that we need to do a better job. So I'm committed to that, made it very clear to our public education department, and you can see today when we're not looking at slides, and you see all the people up here, every cabinet member has a responsibility to make sure that we protect New Mexico families and support them to the highest degree. So we're going to keep unequivocally supporting students and families. So here's an example of that. While there be basically no in-person schooling until after Labor Day, here's one exception. Schools can serve students with special needs in person or small groups or in one-on-one settings. This is another group of students who are not getting what they need, and they need both emotional and physical health care supports that were being delivered to them in a school setting. So if they can't come back to school, all of that is being minimized. So this is a group that we believe we can safely serve and we can meet those needs, and that if we don't do it in a school setting, we are minimizing potential and abdicating our responsibility in ways we are refusing to do. So that's one exception, and we're going to be working with all of those students and their families and the school districts to put this together in short order. Schools can also serve small groups of K through 3 students, so kindergarten to 3rd grade, in person. If we can figure that out, and schools are going to work with us, so no more than 5 students per teacher, because we're doing that effectively in our early childhood programs, then we can do that. And we are asking school districts for this exception to prioritize students who are most in need of learning support. Why would we have any exceptions? Small, so they can be socially distanced. We don't bring back all the educators at once. We focus on the hardest hit and the most difficult to adequately serve students, and we do that in groups that already meet the groups in the public health order. And what else am I doing? I already have data from early childhood and child care centers that shows that we're doing it right there, so now we're going to apply it to public education. I'm using data, science, and effective techniques to keep educators and our students safe, and to meet their needs. All right, so the public education department and the early childhood education department are collaborating. We've already stood up many more child care centers. We know we need to do even more, and we're working diligently to make sure that where we can use federal money, that we can boost the amount of child care support to New Mexico families so that their needs are being met while they have job and economic uncertainty in the country and in the state of New Mexico. And higher education, colleges and universities are also deploying online and remote learning across their campuses this fall. And so I want to thank them for continuing to follow our public health guidance and orders to their highest degree. They do have some in-person, in-classroom settings that they have to meet, and they'll be meeting all of our organization and business public health order requirements for in-person services. Next slide. All right, so here's the guiding principles. We are prioritizing the health and safety of our students, their staff, and our communities. We're going to maximize the number of safe, in-person learning opportunities. Talked about that in the prior slide. We are making decisions based on science and data. And why am I saying that? Because in this country, because we don't have a federal effort here that's cohesive, smart, and science-based, we are politicizing public health. These are not political decisions. These are public health decisions. All districts and charter schools need to offer an online-only option, so we're going to make sure that that is occurring. And no schools can disenroll students, no matter where we are in this process, if they choose only an online option. I want to point out that 85% of educators in the state don't feel it's safe to go back to work. I also want to point out that about 40% plus, it's growing, of parents don't believe it's safe for their kids to go back. So we are also making sure that we're creating a proven environment so that they believe it's safe. A couple of things that are not on this slide that I just want to remind New Mexicans about. I've seen a lot of really negative chatter about educators and public education staff. Look, they do this work because it's a vocation. I'm willing to bet that educators all around the globe would do whatever it takes to go provide better education and would do anything to see their students in person. Here's what really worries them. It's not their own safety, which is at risk. It's that they would go home and take COVID to their own children, their own partners, their own spouses, their own parents. Worse, that they would bring COVID because we've got a prevalence rate that's too high in the state. They bring it to a school. They infect a student, and a student then infects their family. I also want New Mexicans to remember this, which is not being talked about, as far as I can tell, anywhere in the country. New Mexico has one of the highest rates per capita, if not the highest rate. I didn't check that data point before this press conference, but we're high per capita of grandparents raising their grandchildren. This means that a student that takes COVID home could lose both their parents to this vicious infection. Right? These are risks we cannot take. It's immoral. We flattened the curve. Good news. I'm seeing more New Mexicans wear masks. Great news. I can show you photos of communities and districts around the country where they've got 90% mask wearing and they didn't just flatten the curve, they crushed it. It's going down. We can do it. We are doing better than the vast majority of states in the country, and we're doing better than our neighbors. And I want you to take heart from that. I do. But it isn't enough. We have to do more. And I know we're all disappointed that we didn't quite make the grade for a hybrid in-person model to start in August. We still have time to do what's right and to drop those positivity rates and to slow the rate of infection so that we can get there in September. And we're going to get asked a question about this, and I've got one more thing I need to do. I know it's taking a long time, but these are tough decisions. And I want everyone who's viewing to know how hard they are to make and how we make them, and that we look at any number of data points and data sets. The last thing I really want folks to know is that I'm going to ask New Mexicans to really think hard about the earlier effort we made before enforcement. We just tried to treat it as sort of a family issue. You broke curfew, don't do that again, my son or daughter. I don't want to take the car away. Look, we are breaking ranks. We've got counties who are all in, who are doing incredible work, and we've got counties who aren't in. I've got local elected leaders who are saying that public health data isn't real science. I've got elected leaders who are posting that face mask wearing is a way to control or manipulate individuals in our state. I need folks to not do that. It is all science-based, all of it. The president, far too long, didn't meet his responsibility by talking about face coverings. Well, he is now. So if it wasn't enough for me and Dr. Grace and the medical advisory team and the very same men and women who provide your daily direct health care to you, right? They're your doctors. You go to their office. You see them when you're well to make sure you stay well. You see them when you're sick. Your doctors are helping us make these decisions statewide. If it wasn't enough to promote this behavior, I need you to double down on rejecting non-science-based myths that are going on around our state. Reject it. Wear your mask. I need you to stop traveling. For the New Mexicans who are traveling out of state unnecessarily, stop doing that. You are bringing COVID. You are taking COVID. And lastly, we're seeing an uptick in violence related to mask wearing. This is untenable. This isn't who we are. It isn't who we are. A friendly reminder, wear a mask. If you can't wear a mask, if you're not going to do it, don't go out. Have everything delivered to you. We have to be all in it together. There are only two sets of tools: your personal public health behavior or not allowing access anywhere to anything. See, I believe in the science of public health behavior. And I have every intention of winning the war against COVID. And that means the best public health practices in the country, that we crush the curve, it goes down, that we show that we can unify. New Mexicans are the strongest, smartest, most resilient people in the country. We have overcome any number of adversities. We're amazing. Let's show the country we were green in all of those measures. We were yellow a little bit last week, now we're back red. People are highlighting that New Mexico's done better economically in this challenge, that we've done better with high-risk populations, that we've done better protecting our healthcare workers, that we've done better with hospitalizations, we've done better managing, bringing in and keeping PPE. We're crushing it on testing. The only thing we're not quite doing is our personal behaviors related to attacking back at COVID, but not allowing it to spread. So if we can win on those other fronts with far fewer resources than our neighbors, we can win this. So let's go win it. We're all in it together, and to show you how much we care, because we do, and that we're fighting for you on every front, before we go to questions, even though it's a very long press conference, I want to make sure that you hear from Secretary McCamley, because I know people are really anxious about their unemployment benefits. So are we. And so we want to give you a quick update. And I also want to tell you, because then we'll go right to questions, Trip, is that we're fighting and your congressional delegation is fighting for you. We expect Congress to do their job and to extend the unemployment benefits. They need to do that. I expect that they will. I just need them to do it sooner than they are. Secretary.
Thank you, Governor. I want to say thank you to August, the man that made this thing. I don't think I've ever gotten so much pleasure out of a little piece of plastic. That's very comfortable. Thank you. So I wanted to give everybody a quick update. If we could go to the first slide, please. Federal pandemic unemployment compensation. For those of you that are paying attention to unemployment, that is the extra $600 per week that has been going into people's pockets when they're on the unemployment system. So how does this work? When you apply for unemployment, our staff will look at the wages you've earned over the past 18 months and determine what is called a weekly benefit amount. It's a WBA. And that goes anywhere from $87 to $461 a week. Since Congress passed the CARES Act on March 29th, everybody who is getting any kind of unemployment has gotten an extra $600 a week on top of that to help them live and get through this tough situation that we're all in. That program expires this week. So what does that mean for you? In unemployment, you always get your benefit payment, your checks, the week after the week you qualify for it. So if you certify for this week, you will get that extra $600 in your bank account or on your debit card next week. After that, we currently don't know. As of now, that program expires. Congress is talking about it. I'll talk about that in a second. But as of now, that program is expiring. Last week, just to give you guys some numbers, about 135,000 New Mexicans were receiving payment through the 3 separate unemployment programs we have running in the state. That's the standard program that lasts for about 26 weeks. That's one of 2 extensions to the program that lasts 13 weeks apiece. One for the pandemic by itself, another one which is a regular extended benefits program for when you hit a certain amount of unemployment, and pandemic unemployment assistance. This is the program that many of y'all know about that's helping the contractors and the gig workers out there, helping them get through this. That's not a normal program. Every single one of those folks, though, is getting a weekly benefit amount plus the $600. The total amount that has been paid out through all the unemployment programs in New Mexico since March 15th this week reached $1.4 billion. And I want to take this opportunity to thank all of the folks in the Workforce Solutions Department, as well as all the other state agencies that are helping us on the phones, in our mail rooms, in our training departments doing appeals. Everybody, thank you so much. Your work is making people's lives better, and it is appreciated. I would also like to say that we're going to keep our heads up and we're going to make sure that we do everything in our power to make sure that everyone gets all of the unemployment dollars that they can get, and we're working as fast as possible on that. If I could go to the next slide, please. Where are we at right now? So the U.S. House of Representatives back in May actually passed a bill that was granting that additional $600 per week through January. But remember, from ninth grade government, you got to pass something through the House and the Senate. The Senate has not introduced a bill with their proposal on it yet. We were hoping to see that today. I was actually scrolling through the news before we came in here. They just announced on the Senate leadership that they were going to try to introduce something next week. Now, they've got to negotiate back and forth before they come up with something, and nothing has been settled yet. There's a whole bunch of proposals out there. We have not heard of any kind of settled policy yet, so we don't know what's going to happen. Furthermore, even if Congress does approve something, many times we might actually have to, I'm skipping a thing. If they don't approve something, and we're hoping that they do, and I agree with the governor, we want them to do things faster so people don't see a gap, but there could be a gap in benefits starting that first week of August, and we just want everyone to be aware that that is a possibility. Furthermore, if they pass something and it's a lot different than what we're doing now, sometimes we have to wait for the U.S. Department of Labor to both A, make sure the money's available for whatever program comes out, because all that funding is coming from the U.S. government, not the state, and B, if it's complicated, wait for rules from the U.S. Department of Labor. We had to wait, I think, a week and a half before we could actually work on the pandemic unemployment assistance program back in April, because we didn't have the rules set up from the Department of Labor. So I just want everyone to know the specifics of what we're going through with these programs. Next slide, please. So what can you do? The most important thing that you can do is to certify your unemployment benefits every week. Now, why is that important? If Congress passes something, there's a possibility they could make payments retroactive. So if there's a gap of a week, two, hopefully there's not, but if there is, if you certify for those weeks and Congress passes something that is retroactive, we can get you that money as back pay if you certify your account. So please continue to do that. Furthermore, if there's a gap and you've been relying on this money, we know how important this is. Trust me. I've probably helped 4,000 folks individually in the last 4 months personally with their unemployment accounts. We hear how important this is to you, and we get where you're at. Please, please, please go to newmexico.gov/I-need-assistance, that website right there. There are pieces of information there on childcare, utilities, health care, where you can get legal help. We, as a state agency, and the governor's done a great job putting us all together, so we're all rowing in the same direction, are trying to help people in a lot of different ways. You can find some help at that place. You might even want to check it out now. Furthermore, if you look at that picture right there, if you have an unemployment account and you don't know what your weekly benefit amount is, go to that account and you can see right there where the highlight is, where you can find that weekly benefit amount. Now, this person over here actually has their weekly benefit amount. They actually have $650 because they have 2 dependents, and you can get $25 per dependent. But that weekly benefit amount is if there is a gap. That's what you're going to be getting. So that's where you can go to know. Now, Governor, I'd like to just close on a couple of different things before I turn it back over. Number one, I get a question a lot of times. Do we think that this $600 a week extra is a disincentive to work? Are there examples of people maybe staying off to go back to work? Possibly. But what the data is showing us is that the majority of people want to work. They want to go back to work if they can. In fact, there was a economist, this guy named Ernie Tedeschi. He actually used to be the senior economist at the U.S. Department of the Treasury. And he actually took all the numbers of the people who went back to work in June across the United States and found that 70% of all the folks that were getting unemployment that went back to work actually got less money on their jobs than they were on unemployment, but they went back to work anyway. So that argument that it's a disincentive, it just isn't backed up by the numbers. People want to go back to work, but it's about the virus. It's about creating an environment where people are safe. And the more we wear our masks, the more we socially distance, the more we flatten the curve and knock the curve down on this thing, as the governor and Dr. Scrace, if you've been hearing them saying that for months, the more we're going to be able to get people off unemployment and back to work. Makes our jobs easier. It's better for y'all. We all work together in this thing, we do better. Thank you very much, Governor.
Thank you. All right. Right before we go to questions, I heard that we might have had a little audio difficulty, and far be it from me to not shamelessly support talented New Mexicans. So the little device I'm holding in my hand is a plastic, looks like an arrow in two different directions, but basically it connects to the back of your mask, and it takes the pressure off your ears. And so August Hanel, a 23-year-old, raised right here in Santa Fe, northern New Mexico, who now works for Livermore Labs in California. We want you back, August. Was clever enough to find it, print it, make many of these available. We might need a whole bunch more for the cabinet. But it just shows that, you know, people are willing on their own time, New Mexicans, to figure out a better way to adapt to a situation that none of us expected and were adequately prepared for. And kudos to August, and thank you very much for providing these to me. He did try to just trip, so you know, he didn't think I'd be able to figure it out. In August, I just want you to know, I figured it out immediately and have photos to prove that, because it is bothersome on everyone's ears. And thank you for giving us another tool for New Mexicans to do better public health practices. All right, let's go to the first question. Tripp, thank you.
Thank you, Governor. My apologies to the reporters and the viewers. I encountered some technical difficulties with the audio hookup, so I will be reading questions reporters have sent in for us today. First, Governor, from Dan Boyd of the Albuquerque Journal, some New Mexico school districts have been planning to start with at least some in-person learning. Why not leave reopening decisions to local superintendents or set regional criteria?
So Dan, I appreciate the question, and for viewers who couldn't hear it, since some school districts have been planning for in-person and there's local control, why not let them do that? Well, for a couple of reasons. As they were preparing, and I think schools have done a remarkable job trying to figure out what are the best COVID-safe practices in partnership with the state. We didn't wait until August to do that. But they also were doing that before our spread rates and prevalence rates were so high. When they're this high, the risks to the educators now are exponentially greater, and risk to kids. Well, they were also preparing to do that. I'm sure they didn't know that one of our large increases is in that 10 to 19 age group. These are factors that are very disconcerting. There is something I do want to point out, Dan, and we're not quite ready to have a evidence-based approach to get it out, but it is a possibility. Because, so when we talked about being very careful about having one region or one county do something in terms of reopening when cases were really low and we were just starting in the state, we were able to demonstrate, and I thank New Mexicans for working with us and paying attention, that because people move and this virus moves, that the decisions that you make have to be statewide. Now, something that myself included, and governors are looking at for education is that this is a little bit different situation, right? Primarily, kids go to school, go back home. So when you open or close, they stay pretty well concentrated in their communities. And if, not if, when we do this, and we lower the number of cases per day, I think it's possible to see that there may be some school districts in some counties or probably some regions that if we don't crush it statewide, which we need to do, I think it's possible that the evidence would indicate that it may be safe for some schools to do in-person learning faster than other school districts. Now, I want to be careful because sometimes people assume that when I say that, you know, it's a done deal, they can just do it. We need to deal with the fact that far too many New Mexicans are getting COVID. But I think it's a valid point by school districts and superintendents who have been doing the right work preparing, and not all counties and not all regions, as you can see in our maps, are impacted the same way. So in a month, we're going to clearly know how well we're doing My goal is that we do it statewide, but we are open. So are governors across the country, and the data suggests that since kids aren't moving in the way that people move, when businesses are open in one county, but they're closed in another, you just make that 20-mile, 50-mile, 70-mile trip. Here it's a little different. So I think that that's a real possibility, Dan, and I thank the school districts who have done everything to really get ready. They care about their kids. Dr. Scrace.
Yeah, this is very preliminary, but the modeling team, Dan, was looking at mobility data, another source of mobility data the other day, and in some counties, G. Wang, our crack analyst and data guy, he presented 4 or 5 counties, and I don't have all the data memorized, but I know in at least one county, the mobility, to only 25% of the mobility in the county was actually from people who lived in that county. And so there's a tremendous amount of inter-county mobility in New Mexico, and that's, I mean, if everyone were to sign an affidavit that they wouldn't leave their county, it would be easier to pull things like that out. But we're a very mobile society, even in a lockdown, and I'll come back. I'll get back to you on what percent of counties do we have where even 50% of their mobility is their own folks. So
again, data-driven. Possibility that some schools will be ready first. And I guess the question really is, could they go before the 7th? Today, the answer is no. As we see trends, if we do better than we think we're going to do, we can take a look at it again. But for right now, except for the 2 exceptions, elementary K through 3, 3rd grade, smaller groups, and special education students, we're pausing in-person classroom until September 7th. Next question.
Governor, Secretary, Dan also asked why PED Secretary Stewart is not taking part in this briefing. And along the same line, Chris Ramirez of KOB asked that when school districts begin their reentry work, what expectations do you have for Secretary Stewart, and do you expect him to be in New Mexico by that time?
So for viewers who may not know the genesis of that question, Secretary Ryan Stewart was recruited out of state to be the public education secretary. And I think he's doing an amazing job under incredibly difficult circumstances. Like many families, even if you move here from a different community to Santa Fe or county in the state, there are real impacts to the families. So Secretary Stewart, with our full support, his family, spouse kept her job in another state, kids stayed in their school districts. The expectation would be, right, that everyone move here and be ready during the summer when school, when that transition is ready for the family. COVID provided an incredible challenge. So it provided a challenge because if you're coming to New Mexico to look for your house and to do all the work to move, every time you come, you have a 14-day quarantine. Now the whole family has a 14-day quarantine, which means they can't get out and get groceries, look for houses, and do any of the work that they need to do. The same is true for the secretary, who's expected to do his work in exactly the same way that all of us are as we telecommute from wherever we are in the state to work, because we don't have state workers coming to work, because it's not good public health practice and ineffective, and we're trying to control the rate of spread. If he was visiting his family on a weekend, he was having to quarantine. And again, no one to put gas in the car, no one to get his prescriptions, no one to go to the grocery stores. I'm giving those as examples. Didn't make any sense. We made a collective decision that it was far safer and it was a better public health practice to wait out to the highest degree possible COVID. He will be with his family in New Mexico. I hope he's found his dream house in no later than mid-August. And for folks who have economic insecurity and COVID's really dramatically impacting your life, I know that may feel uncomfortable. But I expect everyone to adhere to public health practices. The state of New Mexico will, as long as I'm lucky enough to be governor, will be a family-friendly place to work. And Secretary Stewart is doing everything all day long to make sure that kids are going to get the best possible education under these incredibly challenging circumstances. So just want to make sure I put those questions into context.
Thank you, Governor. We'll stay on education here. Robert Knott with the Santa Fe New Mexican asked whether you are, Governor, willing to extend the Labor Day openings past the time frame you've established if the spread is not diminished, and is it possible, in short, if the entire semester could be conducted remotely with students at home? And second, he asked whether you have any concerns that districts will have less money to work with this year under tough circumstances.
So Robert, I hope that I don't have to do any of the things that you identified. Robert Knott asked, I'm going to do it backwards. Are we going to have enough money given all these challenges and the investments that you have to make for distance learning and hybrid models and additional daycare, all childcare, all the things that are required? I hope we're going to be fine. The schools got money directly from Federal CARES Act. I think it's possible that in the second round that we talked about that is supposed to also include fixes to unemployment benefits for individuals in the country is also going to have more money for schools, including, I think they're talking about making sure states have access to broadband infrastructure dollars. And again, that doesn't fix the connectivity in a minute because you got to do the infrastructure work to get it done, but there's a real recognition. Schools need more money, and COVID safe practices, PPE, shields, gloves, sanitizing, cleaning, training, social distancing, more spaces for kids, all of that is expensive. And businesses who are having to do that to stay open will tell you it's expensive. So yes, I feel good, not overly confident, but good that we're going to have the resources we need to do all of that. Is it possible that New Mexico and the whole country ends up in just a distance learning environment? I think that it's a possibility. I really hope it isn't. This is not fair to the kids in terms of students. I need to be careful. We've got young adults in this mix who are caught in the entire world trying to figure out what to do in a pandemic. It is not the best learning environment. Older kids do better. Younger kids who are learning, right, devices, technology, they really need that one-on-one support. So I really hope that's not the case. The last question is, if you don't have to do that for delay in-person learning for an entire school year, could you delay it past the 7th? I think all those things are possible. But here's what's also possible. We, in 2 weeks, can show that we can stabilize. New Mexicans have shown that they can have behavior changes in 2 weeks. Countries have shown unequivocally that they beat back the virus. So we know it's possible. We've got in-person learning going on around the world. If they can do it, we can do it. Will it be hard? Yes. Are there challenges that yet unforeseen? Probably. Is it going to take all of us to really commit and double down our efforts? Yes. And if we don't do that, we have more risks. But I really, really want to support families and safely educators who want to safely return to work, the entire team. So I guess it's all possible, but I want to end on a high note. We've shown that we can really do well combating this infectious virus. Let's do it again, and then let's sustain it. Because when we sustain it, families do better, families are safer, families have more opportunities in New Mexico.
Thank you, Governor. A couple people asked a question along the subject line of the testing reagent shortage that a few hospital systems reported this week. Susan Montoya with the AP asked, testing has been a bright spot for New Mexico, but I'm wondering if the recent issue with testing supplies in Albuquerque is going to complicate matters as the state tries to get a handle on the spread and positivity rate, and particularly now that we're on the verge of some school staff and teachers preparing to resume education efforts. And Michael McDevitt with the Las Cruces Sun-News asked whether the reagent shortage is affecting Las Cruces or the southern area of the state where test kits are sometimes shipped north.
Okay, so Susan and
Michael McDevitt.
And Michael. Thank you both for the question. I really wanted to talk about this. I'll try not to be so detailed about it. Look, reagents, which are the enzymes that you need, that in a laboratory instrument pull out the virus and tell us whether it's present in a person's nasal, pharyngeal, or saliva sample. have been in short supply around the country. It is a very complex scientific laboratory process that I might have to defer to Dr. Scrace about. Those have always been in short supply, and we've been, New Mexico, very aggressive about making sure, like we were with PPE, that we've got arrangements for the different manufacturers and laboratories that produce enzymes that are, the reagents, enzymes, that are required for each instrument. So depending upon the kind of laboratory instrument, depends upon what we call kits. The commodity on the front end, which is the test tubes and the swabs, and the reagents on the back end. And each laboratory instrument that we use is tied to a specific private sector company that produces that. I think actually reagents, even with the number of increased testing around the country, are okay. They're not great, but they're okay. A lot of the commodity side, the swabs and the test tubes now, those are in short supply. What we saw in New Mexico by our partners, and they're going to work with us better, we're all committed to being more effective partners. When you're combating and you're living in an emergency, we don't always communicate as well as we should. So I think that communication was prematurely put out there. We are always worried about reagents and the commodities. It is true that one of our largest labs, Tricor, was seeing that these products weren't as available and that our shipments were beginning to decline. So that's declining. The number of tests that we're doing increasing. So there's a disconnect. At the same time, we began to be more strategic with our testing partners. Where we want good, solid medical advice, and that's for symptomatic individuals, and we all do that. The state does that as effectively as our private sector partners. All of our nurses, all of our doctors, all of our healthcare folks in New Mexico are all amazing. But that takes lots of time. There's a very different set of relationships and screening and communications when someone who's got symptoms drives through for a test than there is for someone who has no symptoms and may not need to go immediately to a hospital, and where we let people know you're coming, right, so that we don't have COVID spread at a hospital or an emergency room. So it's just different. We wanted our private sector partners to screen symptomatic individuals and that they would know immediately in their own systems that people were coming to the hospital. Public health, the state, we would be doing everyone else. That got mixed up in the way in which we communicated to you, reporters, that we were worried about the supplies, that we were shifting who we were testing, and it got a little garbled. So you should expect us to put out a joint statement with all of our partners that fixes that. So today, I've actually gotten confirmation from several companies, including Cepheid, Thermo Fisher, and Roche, that more supplies are coming, even more than we expected. That's all good news. I'm working with a couple other companies. I haven't quite got them lined up yet, but I will. I've been very successful, and I expect to do that again. Southern New Mexico. Those labs, Quest and LabCorp, ship out a lot of their samples. And I don't know how well other laboratories are getting their shipments in other states. And when they're waiting for supplies, a sample may not get run in a laboratory instrument for an extra day, or worse, 3 days, even worse, 1 week. Worse than that, 2 weeks. This is happening in New Mexico. So we've got partners who are all, I'm not trying to say that they're worse than anybody, I'm just saying the system, because there's not a statewide testing strategy, that those labs don't have the same situation that the New Mexico State Lab and Tricor and some of our hospital partners have. And as a result, it's taking way too long. And yes, I think that's directly related to having enough personnel, to having a payment system that makes sense for everyone involved in testing. That's a federal government problem. And that they don't have a testing strategy to make sure that commodities and reagents are flowing in the way that they should. And it's something I'm really worried about, which is why we've tried to centralize as much of it as we can so that our basic Presbyterian, UNM, Lovelace, Public Health, Tricor, State Lab, We want that to be the statewide genesis and our hospital partners, because 24-hour turnaround, more often than not, and I lead going after most of the supplies, although Tricor, you're pretty amazing, but we have a good system. So if I can help Quest or LabCorp, we're available to help them, but it is very challenging. So I think Southern New Mexico and Memorial Hospital have delays that they should not have. Yep, I'm sorry.
Two quick things. One is, I don't think any other governor in the country has a grasp of these issues like our governor does, and we're privileged to live in a state where she has really driven this improvement and the testing from the beginning when it comes to working with labs and the reagents. And so it's a real treat for me that she's so focused on this, because of course the vast majority of the data I present comes out of the testing that we do. All those maps, all those graphs come from the testing we do. One last thing I wanted to mention, in these ongoing discussions with our private partners, we have been talking about pooling, and I went over that a little bit on Friday, but there are ways, once you have the swabs, to, in an automated way, combine the specimens in order to actually test 5 specimens at once, and then if one is positive, go back and test the other 4. If you do that on 100 people, you don't have to do 100 tests or use 100 sets of reagents. You only have to use 45. We're in discussions with both State Lab and Tricor. Both are investigating that this week. One lab was approved through the FDA to do pooling. We think we're going to see a lot more of that. It doesn't help on the swab side, but it will help with reagents and particularly lab throughput, because if the labs can run 45% of the tests that they used to, they can use that volume to do more testing. So I think we're actually making good progress and meeting tomorrow to further define these details. Thank you, Governor.
I appreciate that. And maybe what we can do for viewers, even as early as next week, is really talk. Testing is a very complex, scientifically based efforts. And we had earlier talked about antibody testing, and now there's great discussions on antigen testing. And New Mexico continues to be, because I've got great partners, mutual admiration, we do it together. So we are in always the queue to be one of the, if not the first state, one of the first states. So we're already in the queue to have permission to do pooling. We met directly in person with Dr. Birx from DC to make sure that we were lined up to do that. I'm very optimistic about maximizing the resources we're going to have. We're in it for a year so that we can do that productively. But I also agree that it's not one over the other. We're going to have to build capacity and manage capacity in a number of ways so that we can test our educators where we need to, rapidly respond to a school, test our students, support families, test families, communities, make sure that we're really reducing the spread of COVID. That's how we beat it, and beat it we will, because that's just how we roll in New Mexico. We're competitive and effective, and we're going to beat it. So let's beat it. Trip.
Thank you, Governor. Jeffrey Plant of the Silver City Daily Press asks, will the state be prioritizing the return of test results for educators and school children, what the expected turnaround rate for educators and school children might be, and what the current average test turnaround in New Mexico is?
So Jeffrey, thank you for all those questions. Yes, once we do anything where we are introducing, right, we have an obligation to provide education. We know that education is better provided for most students, actually not all students, but most students in a classroom. But it's also now in a COVID world, we're introducing risk. We have testing strategies that we have to meet every time we do that. So yes, we would do it. We would do surveillance. We do that in early childhood and child care centers right now. So we have a testing system. I might have to have Dr. Grace look that up, but we look at every week a random. So we do a sample of folks working and a sample of students. And we need to be careful. We don't want to be over-testing little ones. It's a traumatic, can be, experience. We also have to make sure that we have testing supplies for rapid response. So when we know there's an issue, then we have 100% depending upon the issue and depending upon the risk. So like corrections, like nursing homes, we go in, everyone. All right, so we're clear about that. Yes, we build that into our system. That's why you've seen us go 3,500 tests a day, 5,000 tests a day. We need to do 7,500 tests a day. I know that we have capacity in terms of laboratory instruments, maybe not laboratory personnel, to do it 10,000 and more, but challenged by the supply chain and the personnel chain, which is why if we don't have the number of cases and then the folks who are exposed that we have to test potentially, it depends on how that exposure looks. If that doesn't come down, to your point, does that limit where we can test in surveillance? Yes, it does. And when it does that, then I have to make untenable choices between rapid response at a hospital versus a rapid response at a school. So, but we have those strategies where we would close down, sanitize, test everyone, do contact tracing. We have to be able to do that. So the answer is yes, unequivocally, and school districts know about that and are working with us. Our average time is 1 day. Here is a lag that we will and are always improving. When I get at 6 in the morning, 343 tests, and actually we get them all day long, but we get the overnight results from the day before, and all the samples run around 6 in the morning. Calling 343 people may sound easy. It is not. And there are not thousands of epidemiologists. They need to make that investigatory call. There's a whole lot of information we need, and we need to get it right, or it fouls up contact tracing. It could put someone who needs healthcare attention immediately in a situation not to get it, or worse, we can't find you. And you don't know that you're positive, even though we tell everyone who gets tested, stay home until you get a result. When that doesn't happen, they're spreading, or they are at home, but they have a large family, multi-generational family, and they don't know that they have it, and they're not all separated and masked up. I mean, that is incredibly hard to do, and it must be done immediately. The more cases we have, it can take too long, so there can be a day lag between the time I know you're positive and we get to every person. Part of our measurement is to shorten that and to have more people making those calls, and they have to have enough medical training and epidemiological support so that we don't make mistakes on that positive test communication. But we are holding pretty close to every time we get the positives. The turnaround time in the testing is a day, turnaround time, so everybody knows, a day. And we are holding that pretty consistently. Not as consistently with all the other contact traces, which we showed you those red boxes that we need to improve on.
Thank you, Governor. A few more questions here. Brittany Hope with KOAT asked a general question about what you want childcare to look like, or what you expect childcare might look like in this interim period until Labor Day. And she asked, will there be devices provided so that students could do online learning as well?
So I have to say that in response to that question, I really don't know the evidence about how effective online learning is for early childhood education. And I'm going to apologize to my experts sitting with me today. They challenged me not to use anecdotal information. But we know that there are incredible online or televised early learning techniques. I'll use the one that I think is universally adopted by most Americans and universally accepted as a very effective early learning tool, Sesame Street. So we know there's an application. I know. In fact, I know that unequivocally because I've got a nearly 2-year-old grandson, and today, in fact, a 5-year-old granddaughter. It's a bit gratuitous trip. Happy birthday, Avery. So I know my daughter and her husband use many of those online and tools and applications and televised or video applications for enhanced early educational experiences. I know that they feel like they get a much better set of outcomes when it's in person at school. We will use every tool and technique to support families where they are. Not every community, not every rural, remote community is going to have a child care ready to go. We have to be open to all of those, and I'll make sure that the Early Childhood Education Department and Secretary Gerginski gets information out about, what we know based on the evidence that she has are places we would recommend that our little ones are engaged in if you have the tools to do that. And then the other part of your question is, what are we doing? Well, we're standing up by getting, business grants so that you can hire, get your building ready to go, get PPE, do all of that so that more child care centers are ready to go. We needed to do that with kids going back to school anyway. Parents returning to work, kids going to school, you need before and after school programs, all of these child care assistance activities. So we are doing that now. We're working diligently. I don't know how many more have been stood up. It's a question I asked my team yesterday. It was a significant number. We have a significant number and a significant ways to go. And more funding for individuals and families we're looking at providing in our system as well.
Thank you, Governor. Chris McKee at KRQE asked, we're hearing that private schools are going to meet in person without masks in August. Is this legal? And probably more importantly, is it safe? And he asked a second question, what kind of 7-day case average does the state want to see for the state to reopen indoor dining again?
All right, two very good questions. So the state's public education department does not have authority over private schools. So we don't tell them when to start. We don't tell them when they end. They have to meet a certain educational outcome so the kids get graduated and et cetera. But we don't have an oversight and we don't fund them. But they are an organization or a business. And that means they have to follow the current public health orders. That means that they have to have COVID-safe practices. That means that your employees have to wear masks, that you can't have more than 5 or 25%, right, of your occupancy. So they have to meet those standards, no matter who you are in the state of New Mexico. Those are in the public health order, and it's part of the enforcement activities that Secretary Kinney talked a little bit about, and we will hold any organization or business accountable. So if they're not wearing masks and they're above 25% of their occupancy or their groups are too big, that is a citable and enforceable action right now in the state of New Mexico. The more important question is it safe? What we know about indoor issues and indoor experiences is it's not safe. If it was safe, we would make a different decision for all of public education. We don't believe, based on the data that we have, that it is safe. So let's talk about the good news for organizations and businesses like restaurants and others. We need to be looking at when can we go back to some of those phase 1B, more indoor services and larger capacity. Right? We have to be mindful of what the economic challenges are and realities, and how do we live in a COVID world. So the rate of infection is where it ought to be. Contact tracing is not where it ought to be. Hospitalizations are where it ought to be. I need to stop seeing exponential growth and higher positivity rates. So here's what I'm looking for. I'd like to see us as a state not get any higher than 4% positivity rate for testing anywhere, anytime. That benchmark is really important because it tells me that not only am I flat, but I can start to see a decrease in the number of cases. That is critical because once we do anything in terms of larger capacity for businesses or look at indoor dining, then we've introduced risk, and I got to be able to manage that risk. Here's the other part about indoor dining. Indoor dining, like any indoor activity, poses the biggest risk. And why are restaurants the biggest risk? Because you can't wear a mask while you're eating. You stay for a half hour, so there's duration, and you don't have a mask on. And we know that the droplets travel incredibly far in the air and can be recirculated by your HVAC systems. So we know it's airborne. And people can't wear masks while they eat. So it is just a high-risk activity. And I wish, everybody wishes, it wasn't the case. Nobody wishes that restaurants have a situation where they are challenged to make it. Every business, every small business is worthy of New Mexico's attention and support. Most of the countries who are successful at lowering their positivity rates and cases each day don't allow in-room dining still. So I hope that New Mexico can prove that we can do it differently. And we're looking at any number of things. Interestingly enough, we're about to test and look at a couple of HVAC systems, and if there's a way to kill the virus or filter it productively, that might be a game changer for any number of businesses that can only conduct businesses in person, in room. So I can't give you the date of when that will occur, but that's what we're looking for. And it will be some of the same gating criteria that we're going to look for in-person schoolroom activities. Dr. Grace.
Thank you, Governor. Just to mention really quickly that, at the time we went to phase 1B, we were running about a 7-day rolling average of cases between 100 to 110. We do not have a gating criteria for a number of cases, which is that goalpost with the only one upright, and so we're talking a lot about that cases per 100,000, which is the equivalent of a number of cases a day, as well as the test positivity rate that the governor mentioned. But we haven't nailed down what that target would be if we decided to add it as a criteria. But nonetheless, it's just common sense that you can't reopen very much of anything when you're at the worst point you've been so far. And the other thing is that the gating criteria really all do go together. And so what we're seeing right now with our missing the targets on the contact tracing is really due to the incredible increase in the number of cases. And so they're all connected. And we don't just use one criteria for anything. We use all four and those 6 measures, and we'll continue to do so. Thank you.
Sure, Secretary.
Thank you. Just wanted to add something on this really quickly. People talk about restaurants all the time, and one of the things that actually came out recently, a couple of weeks ago, JP Morgan, the bank, took a multi-week approach to analyzing 30 million Chase credit card holders from around the country, combining them with the Johns Hopkins data on COVID-19 spread, and found that higher restaurant spending in a state predicted a rise in new infections there 3 weeks later. In-person restaurant spending was, quote unquote, particularly predictive. And so when restaurants remain open, even though the public health order is out there saying, hey, look, you're not supposed to be there, that's one of the reasons that our office is starting to allow for those employees to leave voluntarily and get unemployment as a safe alternative to being in that office. Furthermore, Governor, we hear this all the time, that there's this choice between being safe and having a good economy. And the Washington Post put out a really interesting story a couple days ago, where they compared the opening of Arizona to the opening of New Mexico, and they found that, yeah, Arizona opened a lot bigger and a lot earlier, and initially did better, but as the spread occurred, their economic activity started coming back down. Now they're about even where we are with a lot more cases. And so from a worker perspective, we're not going to get better. We're not going to be able to open up the economy and get people back to work unless we wear our masks, unless we socially distance, unless we do all those things to crush the spread. But that choice between one or the other, it's not. When we do better with the virus, we will do better economically and get our people back to work. Thank you, Governor.
Thanks, Secretary, and I appreciate that. The other thing I want folks to know is that where you end up at the same place economically, which is critical. You also have far more people who died, far more people in the hospital, far more people with significant chronic damage and healthcare issues related to COVID. And many Arizonans who will never be able to return to work because they are so chronically ill after COVID. We will not take those kinds of risks. And I appreciate that the data now bears out that our economy is more stable, short-term and long-term as a result. And we didn't sacrifice New Mexicans in order to get there. And it's exactly what I said would be the path that New Mexico would take. And actually, I'm going to do something a little more gratuitous. I appreciate the shout out by both Republican and Democratic governors that 2020 hindsight, they would have taken the same approach. And again, that's why more elected leaders need to follow the science. And if you follow the science, you'll make the right decisions. And those decisions will protect New Mexicans and make our economy stronger going forward. Trip.
Hopefully time for two more quick questions, Governor. Hannah Colton with KUNM asks, the advocates have continued to call for the release of prisoners. The KOAT television network reported this month that the Corrections Department had plans to reduce the population behind bars by 5% by the end of this month. That would be at least 300 inmates released. Is the state on track to do that?
Hannah, thank you for the question. I do believe we're on track. I did not ask for an update about being on track. Typically I do. Corrections is one of our high-risk areas and also a priority to get right. We've all been trading some of the national data points. There's a national story about how ICE detainees traveling around the country with U.S. Marshals and Immigration Service actually created incredible corrections spread of COVID and also impacted New Mexico, we believe, in the very same way. I'll make sure that Tripp has that, Hannah, for you so you can report it directly. But yes, my understanding is that our Corrections Department is on track. And if they're not, this question will spur me to make sure that they get on track because we have the ability to do that. We think it's responsible, smart, and an effective way to both protect our population, our workers, and do the right criminal justice impacts and reforms to do. So I think we're on track. I believe we are.
Thank you, Governor. Apologize for my pronunciation. Tamara Bicknell Lombardi from the Edgewood Independent asked that in a recent public address, you asked local law enforcement agencies to help enforce your mask-wearing requirements. Since then, local police departments across the state have handled it differently, and as a result, it's being unevenly enforced. If people feel this is unfair, what can you do to address that and get more cooperation from the public and local law enforcement agencies?
Tamara, thank you for the question. I'm incredibly disappointed. Just imagine this, and again, I think the federal effort here has been so terrible and unacceptable that we've politicized a public health emergency. That is not a political issue. And as a result, you've got local law enforcement entities who were deciding that the pandemic isn't real, that COVID is not a problem, and that if we put out as a state a public health order, or worse, because I'm elected as a governor in a statewide office, that whatever I ask people to do or mandate that they do, it's optional. It is not optional. I have both civil and criminal, enforcement abilities through the Department of Health and those public health orders. In addition, we have significant and serious license and worker occupational safety and hazard tools, which we are already using. So I wanted just to say I'm incredibly disappointed. Imagine how New Mexicans would feel if local law enforcement officers were speeding and they weren't in the pursuit of illegal activity. They were texting while driving and on their cell phones. They were not wearing their seatbelts. They were smoking in a restaurant, or they were transporting a minor, an infant, that they had to take into custody without a car seat. We would be outraged. It would be the most irresponsible set of circumstances, and I guarantee you that their leaders would take immediate and swift disciplinary action. How is this any different? We're saving people's lives. We're making sure that they don't go to the hospital. It's a requirement and a mandate. So here's what New Mexicans can do. We're getting, and I might go to Secretary Kinney, we're getting those photos, we're getting many calls and many complaints, and we're going out. And I know New Mexicans know we are also debating these issues in front of fact finders, judges statewide, and I believe in the independence and authority of judges, and we will adhere to whatever judicial action comes down on any number of these. But we are citing, we are closing, and I will tell you this for local law enforcement, where you are also, it's bad enough that you won't help us cite folks who aren't wearing masks and organizations and businesses and restaurants who aren't following public health orders. If you are violating a public health order, there are both civil and criminal tools at our disposal. And local law enforcement, including the sheriffs who have been posting photos of themselves eating at restaurants, should expect to be cited as such and to be held accountable. I'm beyond words. I don't understand how this got politicized, and I don't understand how any New Mexican thinks that's okay. You know, many of us don't agree with the speed limits, but we follow them, and if we don't follow them and we get ticketed, it's expected. It doesn't become a Republican or a Democratic thing. That has to stop. There is unequivocal evidence, and the only, let me do it again, the only tool, and enforcement, you know, since we started enforcing, it's lower than I'd like it to be. Shout out to the state police and everybody else who's working hard to do it. It's uncomfortable telling your friend or neighbor that they have to wear a mask, and if they don't, you're going to give them a citation. I mean, we don't want to do it. The Mexicans are making us do it, and so are our out-of-staters who are being cited. But that extra effort has increased mask wearing, even though I showed you two different examples, one in Taos County and one in Lee County. But we're seeing an increase in mask wearing. And in some communities, I think that's the reason that, well, today was an all-time high and I'm upset, and I know I keep doing this. This is my universal sign language for flattening the curve. We don't look like Texas or Arizona because we're wearing more masks and we're socially distancing. The thing that we're not doing as well, we could do better on the masks. You got to get to 80, 85% before schools are going to be safe. You have to do it. We have to do it. We can do it. But you have to stop moving around. And maybe the other thing I can do a little gratuitously, you didn't ask this question. Look, I'm going to talk more about it next week in contact tracing. But New Mexicans are traveling out of state. And they are not adhering to a 14-day quarantine, and you're not supposed to be going out. Why are you going out of state? Vacations, family gatherings, unnecessary, unrequired business travel. I can see you at the airports. I can see it on Facebook. Our modelers and folks who look at that aggregate data, we know about it, and we can see it now showing up in contact tracing. You are taking that virus to other places. You are bringing that virus back. You are being unfair to New Mexico's economy. Worse, you're putting New Mexicans in the hospital, and some of them are losing their lives. Unacceptable. New Mexicans, we're better than that. So let's do better. All right, I don't want to be negative. Let's do better because we're all in it together. We can do it. Look at the things that this poor, small state is doing better, more effectively than all the other states in the country. We're impacted by how poorly they do, which means we have to be even more diligent. We can do this. We are doing it. We're not quite there. I warned everyone. It sounds like I didn't mean it to sound like that we saw the indications that the data was going in the wrong direction. Shows us that our predictive work forward, and thank you, Lannel, who helps us do that, is valid. I don't think it gets better tomorrow, and I don't think it gets better next week. I'm really hopeful that our activities and our public health practices are going to keep it at least stable so that our rate of infection stays at just barely above 1. But I'd like to see my positivity rates come way down. And I'd like to see my number of cases come way down. And that's going to take another week or two of data. But I have my fingers crossed. But expect the next several days to be just what we've been reporting. Cases that are way too high in far too many places, scattered across the state. We now have widespread community spread. so we have to work harder. Thank you very much for tuning in for so long. Thank you very much for the majority of New Mexicans who are doing your part. And thank you to everybody else who's going to remind the folks who aren't that they are expected to do better. Thank you.